I'm with Karen Raposa. She is a dental hygienist based in Massachusetts. She recently co-edited a book titled Treating the Dental Patient with a Developmental Disorder. She co-edited the book with Dr. Stephen Perlman, and I want to thank you for being with us, Karen. I should mention that the book has a variety of authors that collaborated to write the chapters of the book. There is a foreword by Timothy Shriver, who is the chairman of the Special Olympics. Let me start off by asking you, what prompted all of this collaboration for this book?
Sure. Thank you, Mark. About 7 years ago, it's very interesting. I was attending the special care dentistry meeting in Chicago, Illinois, and Wiley Blackwell, who is the publisher of this particular textbook, was attending. They had an exhibit table, and I happened to walk by and said, "Where's your textbook on treating patients who have developmental disorders?" And they said, "We don't have one." And so my next question was, well, why are you at this meeting then if you don't even have a book on this topic? And their response was that they had been looking for a long time to find someone who could actually take on the project. And so I had a vested interest, of course, with my son having a developmental disorder himself. And I had a lot of friends who were at that meeting and who knew people who knew people. So they said, are you interested in submitting a proposal for it? And I started talking to Dr. Perlman, who I had been friends with for a long time. He's in Boston University. And he said, if you can take this on and get us all together and get this project done, we'll all be more than happy to help you because it's needed. It really is needed. And so 6 years later, we finally got the project done.
Why don't you tell us a little bit about the types of special needs that are being addressed in the textbook, and if there's any particular emphasis, why did you all choose that direction with the book?
Steve Perlman has been treating patients with these types of disorders for many, many years, and so he was really the brains behind. I came up with the outline, but Steve really knew who would be the best fit person to write all these different topics. So, for example, we knew we needed to address one of the biggest things is behavior guidance for patients with these types of disorders, because a lot of times dental care can be provided as long as someone working with this patient knows how to guide their behaviors and help them get through the anxieties and the challenges that they face in the dental office. So there were actually three or four different authors who came together to put that particular chapter together. And then we knew that we needed something on administering some type of anesthesia, whether it's sedation or just different types of local anesthesias in the dental office, as opposed to, again, another chapter that needed to be done related to hospital dentistry, because sometimes these patients are so involved that they can't be cared for in a dental office and need to be treated in a hospital. So we really had to find people who were doing a lot of hospital dentistry with patients like that. And so Dr. Alan Wong out of University of Pacific did that chapter. We needed kind of community-based, what do we do when these patients are out in the community? How do we best coordinate their care and who pays for it? And so Dr. Paul Glassman out of University of Pacific worked on that chapter. So Steve really knew all the people in this country really who specialize and who are doing a lot of this work. And so it was great to bring all these people together. They were all so excited. In fact, we even have an international perspective in the book. And interestingly enough, right now, sales on the book are doing just as well, if not even a little better outside of this country than they are in our own country. So it was really exciting to have all these people just. No one said no. Everyone said, yes, we want to do this. We need to do this. And so that's where we're at.
Well, I think what do you think are the most important considerations for dental professionals who are trying to improve their treatment of special needs patients?
I think if you take a look at what I wrote in the preface for this book, I talked to a lot of dental professionals all over the country about this, and those who attend the courses that I give all say, it's fear of the unknown. We didn't learn about this in school. And so we want to do a good job. We don't want to jump into this and do something that could make the situation worse, the person more afraid, get them more afraid to come to the dental office. If we're going to do this, we want to do it well and we want to do it right. And so I just commend them. First of all, one of the very first steps is taking courses like that to really understand the world that these people live in, because people don't realize it's very similar to treating a patient who doesn't have a developmental disorder. We as dental professionals want to know what their background is, what their life is like at home, what do they do for work, all of those things so that we can make the proper recommendations for them when it comes to dental care. And it's the same thing with these patients. There's just a lot more that we need to learn about them, what life is like for them at home, what their struggles are in school. Do they have friends? Do they not have friends? And then what do we do to help them work through their different challenges while they're with us for about 45 minutes in the dental office? And so learning the behavior guidance techniques, I think, is a very good first step for dental professionals. The first thing is to understand their disorder, understand their challenges, and understand some simple things that you could try, whether it's just talking quieter and slower for them. Versus, when we see children, sometimes we get all excited and want them to get all excited, but these patients really do better when we talk slower and quieter. And so some of those simple techniques can really make a big difference.
Well, Karen, I want to thank you for taking a few minutes to talk with us. This book is available at Amazon.com. Are there any other sources for buying the book that we should be aware of?
WileyBlackwell.com, the publisher, it's available there as well.